We had a patient present to the hospital with lower back pain and fevers. And I want to talk a little bit about a condition called Discitis and why patients should be aware of it as a potential problem. Infections are generally uncommon in the spine, but sometimes bacteria can make their way into the intervertebral disc. Bacteria can enter the bloodstream from a variety of ways, maybe through the mouth or through the gut. Sometimes patients that have problems with IV drugs can get bacteria in their bloodstream from the needle use. The disc does not have a very good immune system. So if bacteria make their way into the disc, the body has a really difficult time fighting it. Patients with discitis or infection in the disc typically will present with lower back pain or pain in other areas of the spine associated with fevers and chills and other signs and symptoms of infection. It's very important for these patients to seek medical attention, and part of the workup would be labs and blood cultures and also imaging of the spine. We typically, if we recognize discitis on an MRI, will have a needle placed into the disc to achieve a diagnosis. Patients with discitis that is caught early on can be treated with antibiotics and usually a brace, and they can have good recovery without surgery. If the discitis is not identified and treated in the early stages, the discitis can lead to destruction of the disc, the surrounding vertebrae, and deformity of the spine, and can be a major problem that requires significant surgical intervention. So if you or a loved one has lower back pain or pain elsewhere in the spine that is relatively new and associated especially with any signs or symptoms of infection, it's important to seek medical attention and treatment.